Okay, good morning, everyone. It's 11 a.m. and we have a good crowd with us here on the Zoom webinar, so we want to go ahead and get started. I want to let you know, first of all, that this webinar is being recorded, and so we'll be able to share information out afterwards with others. And secondly, fortunately, we're going to actually also be able to release a Spanish language version of this webinar, thanks to our staff person, Vicki Kraus, who's going to help us out with that. So we'll also be able to spread the word that way as well. Thanks everyone for joining us this morning in this unprecedented time, really serious time for us here in North Carolina and everyone across the world, really. We send you best wishes and greetings and hope that you're all doing well and you and your families are staying safe. We wanted to just take a little bit of time and talk about a variety of things, issues pertaining to children and families this morning as our first in a weekly series of these updates, webinars, and we're really interested in hearing from you all as well. And actually, our agenda today, as you saw maybe before you logged in, we're going to get an update from Matt Gross from North Carolina DHHS on what's going on that front. The folks, really heroes at DHHS that are working tirelessly along with so many other folks to try to get control of this thing. And then we're going to go through a series of legislative related updates. And then most importantly, want to hear back from you all and get feedback from you all. We are going to try to keep most folks muted if you're willing to do that throughout the call. And Fawn Pattison, our communications director, is kind of helping run things from the technical end today. Thanks as always, Fawn. And before I go on any further, I'd actually like to ask Michelle Hughes, our executive director, if she's willing to say a few words to all of us.
Sure. Thanks, Adam. I want to reiterate what Adam said. Thanks for being on the call. This is a time that is very scary for families and kids and for all the many providers out there in our community. So we are really looking forward to hearing, not only providing folks with information that we hope will be helpful to you, but also to hear from you about what's happening in your local communities and what kind of information do you need. What are sort of the situations that you're seeing with kids and families to help us be better advocates at the state level? So we really want to keep the lines of communication open today and in the coming weeks and months as well. And so do not hesitate to reach out to our staff at any time, whether it's Adam or me or Fawn or any of our team, if you've got information that you need or information that you want to share. We want to hear from you. So, and I'll turn it back to you, Adam.
All right, thank you.
Thanks so much, Michelle. And first of all, we want to get started with Matt Gross, who's one of the, and excuse me on your title, Matt, I believe legislative liaison for the North Carolina Department of Health and Human Services. Matt, along with others on his team, have been working tirelessly, and I know he's got a busy schedule and lots of things going on. So Matt, we wanted to let you go first with updates from DHHS, and then let you go as we move on throughout the call.
Hey, Adam, I don't think Matt's on the call just yet. So okay. If we can jump ahead and then we'll bring him in when he's able to get on the call. Thanks.
Yeah, absolutely. So why don't we go on to the next thing that we were going to talk about on our agenda, which is actually an update, an overview of what was passed. So what we're going to try to do today is hit on many different areas, policy areas related to children and families, immigration, foster care, health, early education, et cetera, et cetera. Everything's moving a mile a minute. But one of the things we wanted to do is make sure that we shared an update about what did happen at the federal level with the coronavirus Families First Response Bill that was passed and signed by the president the other day, to let everybody know what's in that, and then talk about potentially what's coming up in pending federal legislation Then we'll go to Matt and swing more to the state level type updates.
Adam,
So,
sorry to interrupt you again. We do have Matt Gross on the call now. Sorry to interrupt.
No worries. So Matt, thank you for being with us. And, you know, we welcome your update and appreciate it during a busy time. Go ahead, sir. We're not hearing you, Matt. Mm-hmm.
All right, technical difficulties. You want to jump to the update and we'll see if we can get this working?
Sure. So Whitney Tucker, our research director with NC Child.
Sure. So thank you so much, Adam. So I took a look through the Families First Coronavirus Response Act yesterday, and it's actually good that you know, I only did it yesterday because as of Wednesday, they were still making technical corrections to the bill that had been proposed in the House on March 14th. And those technical corrections were passed as an amendment on the 16th. And then in the Senate, the bill with all of those technical corrections passed without any additional amendments on the 18th. So all of this is, you know, happening very quickly, and it's, you know, happening right up to this minute. And so President Trump signed this bill into law on the 18th, and the provisions that I'm going to talk about become effective 15 days from signing. So that's April 2nd, and then they'll last through December 31st of this year. Some of the funding amounts last a little bit longer, but that's just because of the needs of program administration. But the bill's impacts for families are meant to last through this calendar year. So general provisions, I'll just say that there's $100 billion of additional funding that is going to help with coronavirus response. That's on top of about $8 billion that was passed in the first federal bill around coronavirus preparedness, which is called Coronavirus Preparedness and Supplemental Response Act, right? So these are two separate bills that were adding additional money into our programs and services, largely for families to help them to respond to this. Each agency that receives funding through this legislation is required to send a really detailed report of expenditures to both the House and Senate Appropriations Committees within 30 days. So we know that these changes are going to go into effect quickly, and they're going to start trying to gather back information about effectiveness for families quickly so that they can pull together these reports. After that initial 30 days, updated reports are going to be sent every 60 days until funds are expended or they expire. So jumping into the specific provisions, there is a lot in Families First, but I really want to highlight some of the things that are really good for kids. So first, and families, there's more widespread testing and public health supports. So free COVID-19 testing through the emergency response period. So, you know, as long as this declaration of emergency stays in place, regardless of insurance status, whether someone is uninsured, whether they are insured with private insurance, Medicaid, Medicare, CHIP, that they are able to get free diagnostics for COVID-19 with no deductibles, no co-payments, no co-insurance requirements, or prior authorization necessary. There are also waivers that are outlined in the bill that cover the costs through various different programs to make this something that the government can, you know, make available to everyone. Also, under the sort of health umbrella, federal Medicaid payments to states and to the territories are going to be increased by 6.2% through each quarter of the emergency period. And so that's to help with the increased volume of cases that they're expecting to see. Moving on, sort of related to the health work, there have been some additional investments in nutrition, which we know is really important for kids, especially now that so many of the schools have been shut down. So $500 million is going toward the WIC program, so the Supplemental Nutrition Assistance for Women, Infants, and Children. And another $400 million is going to Emergency Commodity Assistance, which is you know, just the program that we use for additional food distribution. So that is really great. We're looking at about $1 billion that's going just for, you know, getting food supports in the hands of families. There are also waivers that are outlined that are going to ease school lunch access for kids now that they are not receiving them in schools. So cost restrictions that are placed on the National School Lunch Act can be waived for the purposes of providing meals and meal supplements during a school closure due to COVID-19. And the Agriculture Secretary can also grant waivers to states that allow non-congregate feeding and changes to the nutritional content of meals and meal supplements if that becomes necessary due to any sort of disruptions in the supply chain, because we know that this is a global issue and that, you know, eventually if it does linger, that could happen. There are also waived requirements for WIC eligibility and administration. So state agencies can now request that Secretary of State waive physical presence and blood work requirements that are normally associated with determining WIC eligibility. And they have until September 30th of this year to do that. So that way people can stay, you know, in place, they can stay at home and apply for these benefits without risking additional exposure. States can also request that the Secretary of State modify or waive some other really specific WIC regulatory requirements if it's just determined that those can't be met to the by the agency due to COVID-19, and that a change would be necessary in order for them to continue to be able to provide benefits. So it's just kind of giving that flexibility to say that, you know, if something has happened within the state that makes it difficult to administer the program, that they can apply for that to be waived. Whatever regulatory hurdle that they had, and they can continue to have those benefits available throughout the emergency period. There are also some changes to SNAP administration that are in this bill. So work requirements for SNAP are suspended from April through the end of the month after the public health emergency declaration is lifted. And also prior receipt of SNAP benefits will be disregarded by state agencies beginning after that public health emergency declaration is lifted. So people aren't being penalized for having gone on SNAP for, you know, the period of this pandemic. And then also it clarifies that in the event of a public health emergency declaration by both the Secretary of Health and Human Services and also by the state, so a declaration of emergency or disaster at the state. If both of those things happen, then state agencies can request emergency SNAP allotments to households to address temporary food needs. And the Agriculture Secretary can adjust reporting requirements and other methods associated with that program to make it more practical for them to implement it in affected areas. So essentially all of the really rigid requirements that folks are used to can be waived to make space for whatever will work best to make sure that families are able to access food benefits. There are also some boosts to unemployment assistance. There's nearly $1 billion in this fiscal year for state administration grants to cover the processing and payment of unemployment insurance. And among other things, to qualify, states have to have demonstrated steps to ease eligibility requirements and access to these compensation benefits. So including waiving work search requirements and the waiting week period, and non-charging employers directly impacted by COVID-19 due to an illness in the workplace or direction from a public health official to isolate or quarantine their workers. So that's a really big change that is going to make a lot more people able to access unemployment benefits a lot faster than they usually would be able to. And we know that that's really good for kids because a lot of parents are out of work now, especially if they had part-time work or service industry work that's been shut down. And the thing that I think is probably going to get the most news coverage is also some changes to emergency paid leave. So two types of leave are laid out in Families First. So paid sick leave and then paid family leave. And so paid family medical leave through the Family Medical Leave Act is usually unpaid leave that workers can take. But because of this, that will be paid leave as well as sick leave. So employers with fewer than 500 employees have to provide 2 weeks of paid sick leave. If an employee is sick because of their own illness with COVID-19, then they receive full pay up to $511 per day or $5,110 total. So there is a cap on that. If the employee is not sick themselves, but is acting as a caregiver to their child or to someone else, then that 2 weeks is paid at 2/3 of that employee's regular rate. but limited to $200 per day and $2,000 total. Sure, I see someone asking if we can repeat that, so I'll do that. It's a little complicated. Okay, so paid sick leave. Employers with less than 500 employees have to provide 2 weeks of paid sick leave. If an employee is sick because of their own COVID-19 illness and treatment, then they receive their full pay up to $511 per day or $5,110 total. That's the max if the employee themselves is sick. Now, if the employee has applied for sick leave to care for their child or for someone else, then they receive sick leave for that 2 weeks, to $200 per day and a total of $2,000. Very specific. And then in addition to sick leave, there's also family medical leave. And this bill specifies that you can have up to 3 months of job protected paid family leave. But because of the changes that were made earlier this week, on Wednesday, that leave can only be taken to care for an employee's own children whose schools or childcare facilities have closed. And so the paid family leave is paid at 2/3 of that employee's regular rate with a max of $200 per day or $10,000 total. And so the thing about this paid family leave is also that there's a 10-day waiting period before that benefit applies. Employees are able to use their existing sick or vacation time to cover those 10 days before that leave benefit kicks in. And then once it does, they're paid 2/3 of their regular rate for up to 10 work weeks, right? And also the bill is really great because it does specify that employers can't force you to use up your vacation or other sick time before receiving this benefit. And they can't force you, if you're using the sick leave benefit, to find your own replacement before you go out on sick leave, which we know a lot of employers do and causes a hardship for families. There's also a tax credit that's laid out for those who are self-employed that's equivalent to the sick leave amount. So if you don't have, an employer per se, they do have some specifications for that. And then also for employers with 50 or fewer employees, the Secretary of Labor can exempt the business from these requirements. And then employers with fewer than 25 employees don't have to restore employees to their previous positions if they take this leave and they are unable to keep their business running without that person. But those requirements are a little more detailed. Also, employers will receive tax credits for 100% of what they pay out to employees in these benefits. So it's really not hurting employers to provide this for people. Now, I know that was a lot, but as Fawn put in the comment section, we're going to be putting out a fact sheet on this later today. But the important thing I think for you guys to know as advocates is that we're going to have to start pushing immediately to restore more expansive benefits to families in what's likely to be the final coronavirus response bill that's in the works right now. They're looking at it. It's looking like from some of our national advocacy groups, we're hearing about $1 trillion worth of aid will go into that. And we're trying to bring back some of the cuts that were made to this current coronavirus bill, especially when it comes to things like paid leave. So there used to be a 14-day waiting period that was cut to 10, and that was good. But then there also used to be, for example, a more it is only applying to cover care for an employee's own children if their school or childcare facility is closed, right? So a much narrower scope, and we want to broaden that back up to help people who might have non-traditional family units, but still a lot of important caregiving responsibilities.
Thanks so much, Whitney. We appreciate that. You were freezing up just a little bit there, but we got 95% of what you were saying. And thanks so much for the update. And as was mentioned, we're going to be sharing this on our website as well. And we're going to try to talk a little bit about advocacy around the next round of legislation too. But next, I would like to go back to Matt Gross, who is with us from North Carolina DHHS. Matt.
Hey there, can you hear me this time?
Yes.
All right, great. Well, good to be back on the call. I still get emails forwarded to me that were sent to my old NC Child address. So it's good to be back home and on this call. So unfortunately, I have a hard stop at 11:30, but I'm going to try to run through some high-level information, proactively answer some of the frequent questions I've been getting, and then try to leave a little time for Q&A. So, there's a ton going on with this effort. Let me give a few clarifications up front. So actually, for starters, for the latest information, please visit our website, ncdhhs.gov. If you just go there, there's a link right at the top to our COVID-19 part of the website. Guidance for a lot of different fields, the executive orders, some FAQs about the executive orders are there on the top. There's a ton of information. It's getting updated constantly. Also, the case counts are on there, so that's a great place to look. In terms of guidance, one of the big questions we've been getting is, there's different numbers for gatherings, and it's been a little confusing because the feds have put out some new numbers. So just to be clear, as of this exact moment, and things are always subject to change, the enforceable rule in North Carolina is no gatherings of more than 100 people in a singular place. The CDC is recommending that folks don't gather more than 50 in a single place for at least the next 8 months. And the president went a step further and recommended folks don't gather in a group of more than 10 for till at least the end of the month. So the enforceable law is 100. The 50 is a recommendation for 8 months, and the 10 is a recommendation for the rest of March. But again, I think those numbers will continue to fluctuate. Looking at what we're doing with a lot of our efforts. So one of the big areas we're getting questions about is what's going on with education and nutrition now that schools are closed. We've assembled a working group that's been here in the Emergency Operations Center working long hours on a lot of the issues here. So a few of the big things I want to point out to folks. We've set up a toll-free number to connect families in need of childcare options. We're not making that number public yet because we're just trying to circulate it to medical providers because we know that those frontline medical workers, it's critical they have access to childcare. So it's just open to them right now. I think we're going to make that public on Monday. As soon as we have that 1-800 number out, we'll be sure to push it to y'all. Childcare centers remain open. My reports I'm getting is about half the ones in the state are open, half are closed. Of at least the big chains, they're running at about 50% room capacity now. So I'd say if you have any individual folks that are trying to get childcare, I'd recommend calling around to particularly some of the bigger providers in your community and seeing if they have availability, because many are open and still have availability. We've released a guidance guide on our website that you can see with public health information for childcare providers. Also public health or guidance on our website for folks that are for providers that receive subsidy in pre-K. And also guidance that allows childcare centers to relax a few of the requirements around classroom size. Really what it does is it drops everybody from a teacher-staff ratio down to the 1-star requirement. So if you're a 5-star center, you can relax to the 1-star requirement. Didn't feel like we could go further than that from a health and safety standpoint. Other things we've worked on, we've been working on multiple waivers with the USDA for access to food, to feed people through the summer food programs and non-congregate sites. As of now, I think almost 100 of the 115 LEAs have submitted plans to us to start feeding kids through their summer feeding programs. I don't think they're all stood up yet, but it said almost 100, I think last of yesterday was 98 have worked with us to get those set up. Counties are taking different solutions. I know in some counties, they're using the school buses to go around and deliver food. Others have had grab and go and meal pickup sites. Most sites began serving meals on March 16th, averaging about 250,000 meals per day. We've also submitted numerous waivers to the USDA to maximize what we can do with WIC, the CACFP program, SNAP, and the Summer Nutrition Program. We're currently waiting on a lot of those to get approved by the federal government. DPI has established schools as nutrition hubs, and they're connecting them with schools and community organizations with school meals and food packages for households. Other things we're working on in this space, we've launched the COVID-19 Response and Resources website. Again, sorry, DPI launched the COVID-19 Response and Resources website. Go over the DPI website for that, and that's for information for educators and families. They've also published resources on their website for remote learning, which includes instructional resources and items of that nature. DPI has also published resources for parents to support learning for children's grades birth through 2. So check out their website for all that information. So that's a quick update on what that group has been doing. I want to hit on a couple other areas and then turn it over to questions. So we're doing a lot of work in the Medicaid waiver place, and I sent a PDF over to the NC Child folks this morning. They may have sent it to you already or might be giving it to you after the call. We've done we've been pushing for flexibilities in both the innovations program, for the TBI waiver, CAP DA, and CAP C. For this call, I want to hit on a couple of things in the CAP C program specifically. I know there's a lot of folks that tend to join this that utilize that program and it's critical for them. Some of the flexibilities that Medicaid's been able to do in that space include modifying the person-centered service plan development, so enrollees can extend timeframes for which the person-centered plan can be completed, and also so people can do that telephonically. We've put some flexibility to include retainer payments to direct care workers when a 1915C enrollee or the direct care provider is hospitalized or absent from their home as a direct result of COVID-19. We've waived the limits on home modifications, equipment supplies, goods and services, and assistive technology to manage the spread of COVID-19, although that is on a case-by-case basis, not blanket across the board. We're allowing beneficiaries to use fewer than 2 CAP C waivers services during the pandemic without being subject to a discharge. Additionally, we're allowing an increase in service from what is in the person-centered plan with post-authorization when a CAP C service is urgently needed. We've waived the budget neutrality for decisions for waiver entry and continued participation in the pandemic. The last thing I'll touch on, and there's more, but again, they all have a full list. You can send that to your members. We're allowing for specific medical supplies such as sanitation wipes, hand sanitizer, disinfectant spray, tissue, thermometer, and specific items such as colored trash liners to manage the spread of COVID-19. I'll say from a departmental standpoint, one of the big things we're very focused on, and one of our bigger concerns is trying to make sure we are getting enough personal protective equipment or PPE supplies into the state to get out to frontline medical workers. We are chasing every lead imaginable to try to find them. When we heard that Lowe's was selling them, we reached out to them and got them to donate $50,000 to us. We got $10,000 from Home Depot. We're chasing leads in foreign countries. Also now working with some North Carolina manufacturers to see if we can get some of the proprietary information for the manufacturing of these supplies from folks that are having supply chain issues to some of our own home-based manufacturers that want to step up and produce more PPE here at home. That would include masks, gloves, ventilators, bed sheets, you name it. Very focused on that. I'd say from a testing standpoint, where the guidance for testing remains, if you want to have your test done through the state lab, there's no cost to the person to do that, assuming they go through the public health department, FQHC, or local health center. The requirement is you must have a fever of 100.4 or above, cough and respiratory challenges, and have a negative flu test, because frankly, we're still seeing more flu cases than COVID-19 cases. If you meet all those criteria, you can still get a test from the state lab. Several hospitals are doing their own in-house testing, and several providers are doing testing through LabCorp and Quest. Some of those might have different lower designation thresholds. That being said, we're going to reach a stage at some point in time here where the shift is a little less from testing everybody to, if you're somebody who's not in an at-risk category and you are sick, stay home and don't infect people. Knowing that you have this doesn't change the course of treatment unless you go into a medical facility. So we're not there yet. I don't want to panic folks, but we're starting to see nationally there's a shift towards that, and a lot of that is focused on trying to preserve that personal protective equipment for frontline medical workers that, frankly, if you're using that to test, say, a young person who's healthy, to say, yep, you have this, go home and isolate. Well, if you have the symptoms, go home and isolate anyway. We can save that equipment for when they're treating folks that are in really critical care and in the ICU. So again, not there yet, but we've seen states shifting that way, and I think you'll start to see us shift that way over the next little while. With that, I've talked a lot. I'll stop and see if there's a few questions I can answer. Oh, one last thing. 211 has stood up for this. So if anybody has any COVID-19 related questions, please don't hesitate to call 211. They can answer it or refer folks out to the right entities. So please use 211 for any COVID-19 related concerns. And with that, I'll stop and see if y'all have any questions.
Thanks, Matt. I'm going to be reading questions off the chat box. So we're getting a lot of questions around childcare and that 1-800 number for healthcare workers to access childcare. If that's something you have at your fingertips, it'd be great for you to share it now. Otherwise, we'll distribute it afterwards.
So again, that is a line that we are sending out. We've been sending it directly to the medical associations and medical providers. We want to keep that a little under wraps.
Okay.
Just from the standpoint of we're working through all the medical societies, so we make sure they get it in their hands of their workers. We're going to open it up to the general public for anybody to use on Monday. So we'll have that out publicly Monday, but we're trying to protect it for just medical workers first. And again, we're working with all of their associations to try to get that in their hands right now, and we'll publish it publicly on Monday. And we'll be sure to send it to y'all then.
Specific to that call-in line, is that a statewide call to find, this is a question from Amy Berry, is that a statewide call to find childcare in addition to the regional resource and referral call centers, or are the regional call centers being forwarded?
I believe it's a separate line, but I don't know for certain.
Okay. And a question from Kristen Ida Cabbage. How do we ensure that families who need care will know which center could accommodate them temporarily during this time?
So that line will be able to help folks with that. Again, we'll have that public on Monday. In the meantime, I would just call the centers in your area and see what's available. Like I said, I know we're at about 50% capacity. So I'd say through the weekend, call individual centers. As of Monday, we'll have that line up. And it sounds like the Regional Resource and Referral Network might be doing that as well. So you might reach out to your Regional Resource and Referral line as well, which I think is also a centralized 1-800 number line.
Thank you. Another question from Amy Berry. What's the distribution process to access the supplies that you all are getting out and getting to people?
That's a great question. So anybody that has a supply request, it needs to go through the county emergency management system, and then that goes back into the big system where we prioritize, because frankly, the need is greater than the supply. I know the Smart Start Network is, I think, by my understanding, stepping up to do a little work with trying to help childcare providers find food and things like that. So I'll defer to NCPC and those folks on that side of it. But in terms of like medical equipment, that's running through the emergency management system. So you would call your county emergency manager or the county public health department.
Great. And one last question around childcare. This is from Mary Scott. How's the 800 number getting information about where each local community has openings for children and where are the children being placed?
So we are constantly in communication and polling all of the licensed providers to find where there's openings and availability. In terms of where they're getting placed, it's just starting, so I don't have information on where they're getting placed yet, other than we're trying to use existing childcare resources first. I know there's been talk about trying to stand up, use existing space like schools, to stand up new childcare for hospital workers. We're really trying to use existing childcare centers that already have their systems and their teachers and their inspections in place first before we start standing up new childcare options. But depending on where there's availability, we may have to do that, but trying to use existing resources first.
Thanks. Those are all the questions I see for Matt in the chat box. So Adam, I think I'm going to turn this back over to you so we can keep moving through the agenda. But first, we all need to give Matt a huge virtual round of applause for all he's doing right now. Thank you, Matt.
Well, thanks for having me. It's good to talk with y'all, and I'm sure we'll be in touch. This is gonna. It may feel like a sprint right now, but this is actually a marathon we're in. So we got to keep on keeping on. Thank you.
Hey, Matt, this is Michelle. Before you leave, hi, how are you?
Hi, good. I can't stop by and get my box of stuff yet.
I wish, yeah, no, I figured later. Hey, this is a hard question, but it's one that we're hearing increasingly from our Child Advocacy Network members. Is the state going to consider closing childcare centers to protect early education teachers and the kids and families that I know we need emergency childcare for, healthcare people and other folks, but broadly in the sense that we're closed schools, we're closing other places. Is the state considering that?
That's a great question. We've spent a lot of time thinking and talking about that and where we are. And I always say today with everything, because the situation is evolving rapidly, big difference in our minds between schools and childcare centers. So schools, we make that call. Also with schools, attendance is mandatory. So families have a hard time making their own decision if they remain open. Let's say you're a multi-generational family and having a child go into a place where they're more apt to get exposed. And, knowing that children are very incredibly likely to come through this just fine. It's like, I think like 99.9% likely to be fine, and that's even if they catch it. They might expose like an older parent or grandparent that has an underlying health condition. So schools felt like something that, particularly because of the mandatory requirement, needed to put an official stop on that. Childcare centers were choosing to leave open for a few reasons. One, frankly, childcare workers are an incredibly critical part of the workforce that are front lines and needed for this response. So just to go ahead and blanket closure at this time, felt irresponsible from that standpoint. Two, because mandatory attendance is not mandatory for children. Families can make their own decisions, and they're not bound by law to send them if they're open. And then 3, these are independent businesses, and they can make their own decisions. We know about half the centers in the state have closed because they've just chose this isn't the right path for me. So we felt like that's been better to handle on an individual center by center basis rather than mandate it from the state level. That being said, everything is subject to change, but that's why we are in the place we're in right now, because they have the opportunity to close if they choose to do so, but want to allow them to stay open. And again, we know that it's really not, the secretary says it more eloquently than I do, but it's not that we don't value the health and safety of childcare workers. It's that the service they provide is incredibly critical to the response. So we want to make sure that there's an opportunity to keep that open.
Yeah, thanks so much,
right.
Matt. And we know you have to go, and we will certainly be in constant contact.
Thank you. Thanks for having me.
Take care.
All right, bye.
All right, everyone. So I wanted to just provide a quick overview of some of the other issues and concerns that we're seeing come forward. Some of this is going to be in the form of legislative language that's being formulated or what have you. Other things are just sort of a list of ideas or concerns related to various topics. And so I wanted to just run through that, and then we can open the call up via chat box for more questions and comments from you all as well. And at the end, hopefully we'll try to wrap up with a few next steps. So staying on the topic of early education, I just want to say that the North Carolina Early Education Coalition, along with many other ones of us, are constantly obviously thinking about this issue, and the Early Education Coalition is actually going to be leading the charge and coming up with a list of legislative recommendations, a priority list that can be shared, I think, at the state level, of course, at the federal level as well. While we know that child care centers, being open, especially for emergency and health personnel, is extremely important, we are also extremely concerned about the effects that continuing to have child care centers open on a broader scale may have for our community health. And so that is something that we're all going to continue to advocate on and around, and we'll also be trying to, of course, solicit as much of your feedback and support in that area. We know that there's going to be a lot of financial assistance for child care programs that's going to be needed if child care programs are going to be able to make it, through this and after this. In addition, very importantly, financial assistance for child care teachers and staff who continue to work, as well as those who are unemployed. We need to be really focusing on that and have a good plan and money in place to support those workers, as well as, how we're doing subsidy eligibility moving forward in the longer term. We're also, things like emergency assistance for child care programs, such as low interest loans, et cetera, are very needed. And then, as you all have been alluding to and Matt alluded to with the 1-800 number, as things move forward, we need to be providing the support that parents need and other essential workers so that they can find child care in a safe setting while they are going off and doing the essential work that still needs to happen throughout this crisis. So in addition, there's emergency food assistance, et cetera. All of that is kind of wrapped in that early education bucket. And the NCEEC will be coming out with this list of priorities. I believe they're going to start doing a weekly call on Wednesdays, and we can share that information, because really, as far as that area of this goes, I think we would like to kind of defer in many ways to that conversation and have those of you that are interested and involved in this, as I know many of you are, work intensively within that group. Another thing that I just wanted to bring up and talk about was there's so many things. Another issue related to children's health that we're hearing about and trying to find answers about are birthing practices, and the fact that because visitation in the hospital settings, et cetera, is being limited very much so. There's a concern that home births and other things that are going to be needed to potentially, obviously to be done in a safe way, we're going to need to be, thinking differently about that. And, certified professional midwives, it's my understanding, are not really allowed to practice in a wide scope in North Carolina. And there are other policies and restrictions there that we need to be thinking about so that we're looking at the infant mortality, maternal mortality angle of this, and coming up with some solutions and working with the state and federal government to come up with some solutions there. Again, not getting into all the details of these things, but just trying to lay some of the issues out there. Another thing I wanted to touch on was very briefly is juvenile justice. There's some issues of concern there at juvenile and the criminal justice system in general. For example, what's going to happen with visitation for children with incarcerated parents? How is that process going to work through virtual contact, et cetera, personal contact between children and parents? We know that there's, already levels of trauma there with children and families when someone is incarcerated, and that's something that we need to be thinking about and getting our heads around. As far as the juvenile justice system goes, an update from DJJ is that they're working to have telehearing equipment available by early next week. And that equipment's being delivered to facilities and districts and may also be available to parents and attorneys to visit electronically with their children, their child or clients in detention in a secure and confidential manner. And they're working as quickly as possible to roll those things out. And we will be notified about that and try to stay in the know as things move forward with that. As the courts have really slowed down to a crawl, at least over the next 30 days or so, at least by order of our North Carolina Supreme Court Chief Court Justice, Sherry Beasley. Another area of concern that we certainly want to stay cognizant of is around immigration and what's going on with immigration during the coronavirus pandemic. USCIS has announced that testing, prevention, and treatment for COVID-19 will not be used against immigrants in a public charge test. So that's good. This is going back to some of the new public charge rules that have been implemented by the Trump administration. They're saying that in relation to COVID, seeking treatment and prevention and testing, et cetera, will not be used against immigrants in any way. However, the issue that we have is there's so much fear and so much misinformation out there. It's hard to sort of sort through that, especially in a time like this. In addition, ICE has announced it will not carry out enforcement operations at or near healthcare facilities, such as doctors' offices, except in the most extraordinary circumstances. That should be a given right now. They really, should be standing down in general. Immigrant families should seek the care they need during this difficult time. It's still safe and smart for them to see the doctor if they need care. But again, because of the fear and the real repression that's gone on in the immigrant community, we know that that's going to be yet another barrier and something we need to be concerned with. One more area is the foster care system. And of course, there's all kinds of issues that can come up related to foster care during this time, placement disruptions, visitation and respite schedules, what's going on with residential programs and kinship requirements, as far as biological families, and working towards reunification, et cetera. How is this going to be treated in the courts in the foreseeable future, and case plan completion and, other community-based resources. And then as far as former foster youth, another concern we've been hearing about is that if they're in college, for example, and colleges are closing, where are those young adults going to go? Where are they going to be able to actually live, find the food and financial resources they need, et cetera, while this is going on. And many of these things can be addressed through administrative regulations, but of course, folks will be looking also at legislative options there too. Last thing I wanted to touch on was just this emerging stimulus package, the $1 trillion stimulus package that is going to be negotiated between Congress. The Republican senators have rolled out their first version or attempt, but that is going to be completely renegotiated along with Senator Schumer and Representative Speaker Pelosi and others to try to come up with a workable bill. There's going to be all kinds of aspects of that that are going to be addressed. One thing in particular that we're going to be advocating on, and we're trying to talk with Senator Tillis and Senator Burr's staff as much as we can, although Senator Burr has a lot going on right now, is to basically talk about Medicaid provisions, the importance of Medicaid and health coverage, and strengthening those even more as we talk about that in the sense of a stimulus and a response. And three of the major things that we're sort of asking, as well as many of our federal partners, are boosting the federal matching rate increase for Medicaid, the FMAP for Medicaid, from all the way up to 10%, increase that up to 10% for states, up from even the 6.2 that was passed just the other day in the first bill. Second thing is we want to see the federal matching rate go up to 100% for states that have closed the Medicaid coverage gap and have implemented expansion, and also as essentially an incentive for states that have not yet expanded to have that 100% cost coverage from the federal level for at least a minimum of 3 years. The other thing folks are talking about is creating a special enrollment period for the federal marketplace and also increasing subsidies for the purchase of coverage and doing things, especially as they know a lot of folks are coming off employer-based insurance and into the marketplace now with unemployment coming up and other things like that. So those are some of the incredibly important provisions. And then, you know, just the direct support to families. You know, we think it's definitely important that low-income, working-class folks are getting a bridge, really a longer-term bridge during this crisis with things like you know, direct assistance. I've seen a provision being thrown out there that, you know, families, poor families would get an extra $500 a month on top of the increased benefits and other things going on. Of course, there's a stimulus that'll go out to more middle class, upper middle class families, and I've heard the range of that, you know, amount of money coming to people is between $1,500 and $3,000 per family, which is another way to stimulate the spending in the economy. However, we want to make sure that again, those provisions are first and foremost protecting poor and working class families and children that are most likely being, you know, economically hurt the most. We're all going to be economically hurt by this. But that's a priority. So what we want to do is now I'm going to be quiet and open it up, and Fawn can hopefully help us navigate some of the questions or comments that you may have. Again, thank you all also for your patience with this. This is our first run of it, and every week we're going to be doing this and trying to, you know, hone things in to have real solid updates. So Fawn, I see that you're, yeah.
Thanks, Adam. So I just want everybody to know we are sending out a recording of this webinar afterwards. We will send one in English. We will also send one in Spanish if you have partners or clients who would be able to benefit from that. And we'll be assembling all these resources and sending them out to you as well. Looking back at our questions in the chat box, jumping back to the federal bill, Whitney, on the paid family and medical leave portion of the federal bill, this is a question from Michelle Rivest. Are there still hardship exemptions for childcare programs? Several have said having to pay these leave programs would put them out of business, and the tax credits wouldn't really help them in time, even if they are eligible.
So as of right now, I have not seen anything specific to childcare programs to exempt them, but employers who have fewer than 50 employees can be exempted. So depending on how quickly they need this assistance, they should be able to get the help that they need so that this won't apply to them, before it becomes a hardship. I think the biggest issue here is that this is just explicitly allowing the Department of Labor to put out that regulation. It's not actually mandating that employers with fewer than 50 employees are exempted. It's saying that they can make them exempt, which they very likely will very quickly, but it hasn't been done yet. So that is still a concern that we have and that we're going to bring forward, especially as we're talking through this third bill, to put their needs front and center as small business employers, essentially, who are really the backbone of all of our other emergency response.
Great. And I see a comment or question from Melissa Zentz that you might want to address around whether these paid family leave supports apply to non-traditional families like kinship placement, foster families, adults caring for unmarried partners, kids, things like that.
So no, that is part of the problem. On Wednesday, the technical additions that they made to this bill actually restricted the definitions of family for the family medical leave portion of this. So it's only applicable when we're talking about the family medical leave to care for a child of the employee themselves who is out of school because their school or child care facility is closed. It's a little bit broader when we're talking about the sick leave pay versus family leave, but that still isn't clarified that it is, domestic partnerships and all other forms of family that are non-kinship. So that is something else that we're really trying to shore up with this third round of funding.
And a question from Heather Murphy, will nonprofits also be eligible for this tax credit?
So this isn't as clear as I went back and reread the bill, because I did see some questions pop up about that after I was reading, but other advocacy sources online that are specific to nonprofits are saying that the nonprofits are specifically eligible in this bill. The problem is that throughout the bill, it references the tax code in different places. So I'd have to go back and double check to be sure for you guys, but several sources have confirmed that nonprofits are eligible and that the credits apply to the tax that the nonprofit normally pays for each employee's Social Security. So that's something. But if the sick leave or family medical leave ends up costing more than the Social Security bill, the government will send the employer a check to cover the remaining costs. But how that will be determined, how that remaining cost will be determined, is up to the Treasury and the Internal Revenue Service. So it's another thing that's going to have to be clarified very quickly before this goes into effect in 15 days.
We just got a question from M. Shannon. I run a childcare center and just received a call from a parent that got us from the 1-800 number. Are there funds to pay for that parent's care, or is it entirely the parent's responsibility?
I am not aware of any funds to pay for that parent's care, but if anybody else on the line is aware of something that I haven't heard of, then I'd be happy to add that to the list of things we want to add in.
Yeah, and this is Michelle. I'm wondering if Michelle Rivest is still on the line, if she or anyone from the Early Education Coalition have any answers about that, or we can go back and ask Matt.
Hi, this is Michelle Rivest. Can you hear me?
Mm-hmm. Yes.
Okay, good. I was on the Education and Nutrition Task Force yesterday that Matt referenced, and as far as the childcare they're setting up in schools, they did say that no, there would be parent fees associated with that childcare, and that that would be determined in the future. So I think it's going to be, sounded like it was going to be a district by district decision. So those are good questions to send in, but I don't think the state is contemplating at this point any relief on the child care payment side.
Thanks, Michelle. Looking at additional questions and comments. Michelle Hughes, do you want to share?
Sure. I just got an email from Liz Bell, who's a reporter with EdNC, and she is looking to speak with a early education provider, a childcare provider, who is still open and serving kids, to talk about your experience with that. So if you are one of those people on the phone, or if you know somebody, if you could directly email me, and my number's in the chat, or my email is in the chat box. It's just Michelle with 2 L's at ncchild.org. Thanks.
This is a question for, I'm not sure who this is a question for, Adam or Whitney, or other folks on the call may have the answer to this, from Melissa Zentz. Other states have classified grocery store workers as essential during this time. Any plans for North Carolina to do that, and then to also open up emergency childcare for those folks?
Not that I am aware of, but it's a good question, and we should try to find out what's going on with that. They seem pretty essential to me.
Same.
We're also getting a message that the president is calling, addressing the nation right now. So wondering if it's time to wrap this call and we can send out all the remaining information that we have, as well as a recording, as quickly as we can.
Yeah, and can I say one thing to folks on the call? Well, 2 things before Adam wraps it up. One is thank you for being part of this call, and we are going to address the capacity issues of the call for next week. I'm getting messages that we were maxed out on Zoom, and so we'll go ahead and increase that capacity for next week, because clearly people are really wanting to connect with each other. The other thing is, if you have questions specifically before next Friday's call, like I'm really needing information on something, or you have something that you want to share, if it's all possible to get that to Fawn or Adam or me before on Thursday, we will do our best to get that information and share that information on the call. So again, thanks so much. And Adam, I'm going to turn it over to you.
I think those sounded like great next steps to me, Michelle. We will certainly share this recording as well and keep folks apprised. I mean, there's going to be some legislative and administrative policy asks that are going to be coming out from NC Child and others next week, and quite honestly, almost daily at this point. So please keep an eye out for those. Vaughn, is there anything else?
I'm seeing lots of great ideas in chat coming through the chat box. I'm glad people are still connecting. And we are going to compile everything that was referenced on this call and share all of that with you. We're working on the best way to do that. Thanks, you all. Also, if you did not get a direct email about joining this call, we apologize. You can sign up for our email list on our website. You can email us directly. I'm sending an email address now, eva@ncchild.org can get you on this list. Also, you may be going to spam. So if you are, you can also add our email address. We send everything from admin@ncchild.org. So you can add that address to your safe senders list, and that may help you make sure that these wind up in your inbox. So thank you all very much.
Thanks, everyone. Stay safe.